Side effects of hormone therapy. Hormonal therapy is an essential component of oncology treatment for certain hormone-sensitive cancers. It involves the use of drugs that either block hormone receptors or suppress hormone production to slow down or inhibit the growth of hormone-driven tumors. The side effects of hormonal therapy in oncology can vary depending on the type of cancer being treated and the specific drugs used. Here are some common side effects associated with hormonal therapy in oncology. Menopausal symptoms. Many hormonal therapies work by reducing estrogen levels in the body, which can lead to menopausal symptoms, even in premenopausal women. These symptoms may include hot flashes, night sweats, vaginal dryness, and mood swings. Sexual side effects. In both men and women, hormonal therapy can affect sexual function, leading to a decreased libido, sex drive, and, in some cases, erectile dysfunction in men. Fatigue. Hormonal therapy can cause general tiredness and fatigue, which may affect a patient's quality of life. Bone density loss. Certain hormonal therapies can lead to a decrease in bone density, increasing the risk of osteoporosis and fractures. Joint and muscle pain. Some patients experience joint and muscle pain while undergoing hormonal therapy. Nausea and vomiting. Nausea and vomiting are potential side effects of hormonal therapy, although they are not as common as with other cancer treatments like chemotherapy. Weight gain. Some patients may experience weight gain during hormonal therapy. Mood swings and depression. Hormonal changes can impact mood and emotional well-being, leading to mood swings and, in some cases, depression or anxiety. Increased risk of blood clots. Certain hormonal therapies can increase the risk of blood clots, which can be serious and require medical attention. Cardiovascular effects. Some hormonal therapies may have cardiovascular side effects, such as an increased risk of heart disease. It's important to remember that not all patients will experience these side effects, and the severity can vary from person to person. Additionally, oncologists carefully monitor patients undergoing hormonal therapy and can prescribe medications or interventions to manage side effects effectively.